The most common stroke is caused by a blocked blood vessel in the brain. And this basically causes that area of the brain to die if we can't open that blood vessel quickly. So up until recently, the only available medical therapy was something called TPA, which is an IV medication that dissolves the clot, or attempts to dissolve the clot and open that blood vessel. But in the most disabling, the largest strokes, TPA is the least effective. So technology and this room have been developed in order to have tools that we can go and grab that clot and actually pull it out of the brain, opening the blood vessel very, very quickly. So we have a technology now called stent retrievers, which is a little stent, little wire mesh tube that we can deploy in someone's clot inside their brain, leave it there for a few minutes, it grabs the clot, and we can pull it out, restoring blood flow almost immediately. Neuroangiography typically requires what we call biplane angiography, which is bi is two. So two different X-ray units giving us two different pictures in two different angles of the blood vessels in someone's brain. The blood vessels in your brain are very complex and very tortuous. They have a lot of turns and corners and they go every which direction. So if I only have one picture, I'm only seeing in 2D. I can only see what's happening right in front of me, but I don't know where, if that blood vessel is going frontwards or backwards. I can only tell if it's going left or right. So with biplane, I get a more of a 3D representation of those blood vessels so that I can navigate in them safely. As the need for acute stroke care has developed and grown dramatically in the last few years, we realized that without a second biplane suite, we couldn't offer immediate stroke care. Because you have to realize these units are minimally invasive operating rooms. We do a lot more than just treating stroke. Like I mentioned before, we treat aneurysms, AVMs, we treat vascular disorders in the entire body, really, in these rooms. So they're often being used. So if an acute stroke came in right now, we can basically always guarantee that one of the biplane suites will be available. With the help of our donors, with the access to a second biplane angio suite, we are now effectively never closed stroke in Northern Alberta.